Parents of toddlers and preschoolers commonly notice digestive changes like gas, bloating, stools that are delayed, constipation around toilet training, or changes after fever and antibiotics. I'm Dr. Madhvi, a pediatrician and newborn specialist from Hyderabad, and this is Kavach. Today, we'll talk about gut health in children aged 2 to 5 years. What is happening inside the gut at this stage? Why symptoms like gas and constipation are common and usually normal, and how everyday food and routines support healthy digestion. This is a wellness and preventive health discussion, not about diagnosing disease. Most digestive symptoms at this age are developmental, temporary, and manageable with simple measures. What is happening with the gut in toddlers? Let us understand. Between ages 2 and 5, a child's digestive system is still maturing and learning to coordinate. Several important changes are happening at the same time. The gut muscles are learning how to move stools efficiently. The nervous system is also learning and how to coordinate bowel movements. Toddlers are also transitioning to new foods, new textures, fibers. You will be introducing spices, some food combinations are introduced, and toilet training also happens at the same time, and this brings awareness, control, and sometimes fear. This transition and learning process naturally leads to gas and bloating, changes in stool consistency, occasional hard stools, and difficulty in passing stools. Today, I'm here to reassure you that most of these symptoms improve naturally as the gut adapts to family foods and as the nervous system matures. Gut microbiome. Why it matters to toddlers now and for life. Inside the digestive tract lives a large community of microorganisms called the gut microbiome. In toddlers, the gut microbiome is actively forming and reshaping, largely because children are moving away from infant foods. They are now eating a more varied family diet. Fiber types and food diversity increase. So these gut bacteria help digest complex foods. They support immune system development, and they also influence stooling patterns, appetite, and gut comfort. Between ages 2 and 5, the microbiome is becoming more stable, but it remains sensitive to diet changes, fever and infections, antibiotic use, sleep and daily routines. The gut and brain are closely connected. This gut-brain connection explains why many toddlers experience constipation during toilet training, appetite changes during emotional stress, tummy aches during transitions. So these symptoms are real and physical. They reflect a digestive system and nervous system that are still learning to work together. So, how to develop a healthy gut microbiome? Certain foods naturally contain beneficial bacteria and are known as probiotic foods. Common foods in Indian diets that are capable of delivering beneficial bacteria to the gut include dahi or curd, fermented foods such as kanji. Kanji or ganji may be known in Telugu as ganji, and in Kannada also they call it ganji. Kanji in Tamil and kanji in Hindi. So different pronunciations. The preparation varies, but the principle of gentle fermentation remains the same. These are beneficial gut bacteria and they support digestion, help restore gut balance after illness, gently support immune development, help maintain a healthy balance of gut bacteria. However, an important point for parents in this is probiotics alone are not enough. They also need prebiotics. Prebiotics are types of dietary fiber that feed beneficial gut bacteria. A simple way to understand this is probiotics introduce helpful helpful bacteria, and prebiotics help them survive and grow. So prebiotic-rich foods suitable for toddlers include fruits and vegetables, whole grains and lentils and legumes, cooked onions and garlic, and bananas and apples. The goal is to create a supportive environment through prebiotic foods and regularly replenish the gut with beneficial bacteria through probiotic foods. Using one without the other is usually less effective over time. You can think of your child's gut as a living culture. Probiotic foods introduce beneficial bacteria, prebiotic foods nourish them, and regular meals and routines help maintain the balance. Antibiotics and the gut. Let's know about that. Antibiotics are sometimes essential and life-saving. However, antibiotics act broadly. They kill both harmful and the beneficial bacteria. After fever or antibiotic use, children may experience gas or bloating, loose stools or constipation, or temporary appetite changes. We all have seen these. These effects are expected and usually temporary. After illness or antibiotic use, it is helpful to gently support gut recovery through returning to regular meals and routines, thoughtful inclusion of prebiotic and probiotic foods, ensuring adequate hydration, encouraging physical movement, and gradually increasing fiber intake. Food-based remedies for early constipation, let's discuss. In India, children typically pass stools daily, particularly when eating home-cooked foods and fiber-rich foods. When a child who usually passes stools daily skips a day, this is often considered the early beginning of constipation, and parents appropriately begin some gentle home remedies. This early recognition is helpful because constipation responds best when supported early and before stools become painful. For early constipation, a gentle food-based support may include papaya, which is soft, hydrating, and of course is fiber-rich, and amla given in small age-appropriate amounts to support digestion. These work best when offered regularly and without pressure. If constipation persists, becomes painful, or is associated with poor growth or blood in stools, medical evaluation is definitely advised. Now let's discuss about toilet posture and bowel movement. Bowel posture also plays a significant role in how easily stools pass. A squatting position naturally straightens the passage for stool and relaxes the pelvic muscles, making bowel movements easier and less painful. That is why many children find it easier to pass stools in a squatting position. Indian style commodes naturally support this posture. But if a child uses a Western toilet, the same benefit can be achieved by using a small footstool, ensuring that the knees are higher than the hips. The key message is that posture matters more than toilet type, and simple adjustments can reduce straining and withholding. Food intolerance and allergy, let's understand this by putting it in context. Parents often worry that gas or constipation means a food allergy. It's important to clarify, true lactose intolerance is uncommon in toddlers, though a temporary intolerance can occur after diarrhea. Now, celiac disease is rare and should only be evaluated by a doctor. Nut allergies cause immediate reactions like hives or breathing difficulty, not chronic constipation. So, most everyday digestive symptoms in toddlers are developmental, not necessarily due to food allergy. Always consult your doctor before making unnecessary food restrictions. 5 actions parents can start today that they will be the key takeaways. So first is notice stool patterns early. If your child usually stools daily and is skipping a day, is a signal for gentle support. Now pair Probiotic and prebiotic foods offer dahi or kanji along with fruits, vegetables, whole grains and lentils. Use food first for early constipation like papaya, small amounts of amla water or kismis water, prunes water, dates water, and movement are effective early supports. Support comfortable toilet posture. Encourage a squatting position or a use of a footstool to raise the knees. And avoid unnecessary food restriction. Do not remove milk, gluten, nuts unless advised by a doctor. In closing, I would like to tell that gas, constipation and stool changes are often part of normal gut development in toddlers, especially as they transition to family foods. With early awareness, simple food choices, comfortable posture, routine and reassurance, most children develop healthy digestion naturally.